Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast. Dan Carter back in the studio this morning.
Yeah.
Got Dr. Caitlyn with me. How are you doing this morning?
Good. How are you?
Pretty fantastic.
That's a nice hat you got there.
Yeah,
Dan.
you like that?
Yeah, it's nice.
Got some official merch for the podcast.
Yeah.
We're stepping up.
Okay.
So yeah, we're working on our official merch. So y'all be on the lookout for that. We're gonna have some merch.
We're legit now.
We're like Joe Rogan, but veterinary. So like,
Less controversial, maybe.
Probably.
Hopefully.
It depends who you are. I don't know.
It's true.
But yeah,
Depends
we
on the
got.
topic.
I don't know if we're probably just gonna end up giving it away. Like, I don't know.
That's okay.
Yeah, we're gonna have
I'll
fun
take
with
more
it.
letters. We can have more letters.
Yeah, we need some more letters.
Yeah, I got 3. That was good.
I know 3 letters.
Yeah.
For those of you who don't know, when we started this podcast, we found out one day when we were doing it, and Dr. Caitlyn had never gotten a letter in the mail before.
Nope.
And we had
Never
some
ever.
pretty awesome listeners. They broke out the old pen and paper.
Mm-hmm. Put a stamp on an envelope and
Yes.
everything.
You know, some of the kids here don't even know how to address an envelope.
I'm aware. I'm married to one of those. Yep. Yep.
Where is this world going? Well, speaking of letters,
We have lots of letters to talk
we
about
have
today.
lots of letters to talk about. We're going to talk about some PSSM.
Yeah, PSSM 1 and 2.
Polysaccharide Storage Myopathy.
Correct, yes.
You like that segue?
Yeah, that was really good. I was going to comment on it. That was
I mean, that was
smooth.
we're like professional.
You're getting better.
I know. That's a good segue. So let's talk about PSSM.
Oh, yeah. So PSSM, so like we said, polysaccharide, which is a large sugar. So poly, many saccharide sugars put together to make a string of sugars.
Gotta love some Greek.
Storage, so obviously we know what storage means. Myopathy means muscle problem, basically.
That we don't know what it is.
Yes.
Because really, in veterinary medicine, all right, here you go, guys. I'm going to teach y'all to be a vet. If it's inflamed, you name the structure and you put itis behind it.
Mm-hmm.
If it's broken and it's not inflamed, you put apathy behind it.
Mm-hmm. And if you put syndrome on it, that means we don't really know.
Yeah, it broke and we don't know why.
Yeah, we just put it in a box.
But these things all happen together.
Yes.
So now you can speak vet.
Yeah.
Cool.
That's all there is you need to know, really.
Yep. So we got a problem with our muscles involving the storage of sugar.
Correct. Yes.
Yep.
So there's, as of right now, this will probably change in the coming years, but as of right now, it's broken down into 2 types. So PSSM Type 1 and PSSM Type 2. So we're going to kind of go through and talk about the differences between the two, the similarities between the two, and then, like we always do, management, all of those things. So
Let's dive into PSSM Type 1. We'll start there since it's got a 1 in it.
yeah,
It's first.
we go in order.
Yep.
So PSSM Type 1 is a genetic, disease. So it is a mutation in a gene called the glycogen synthase 1 gene, and it was found in quarter horses and then their kind of related breeds, so Appaloosas, Paints, those things. And they found the genetic mutation, and they figured out that it is dominant in its inheritance pattern. So you only have to have 1 copy of the gene to be affected. So that really comes in when you are talking about breeding horses. If you have a horse that has this genetic mutation, if you breed that horse, no matter if you breed it to a completely normal horse that's not affected and is genetically normal, you still have a 50% chance of passing this on. So we really need to know about this. We've really tried to ramp up the testing for this to keep control of it, kind of get rid of it, that kind of thing. But yeah, so it's a genetic mutation, and we can talk about kind of how it causes the disease. But yeah, it's...
And as far as you hear about a lot with quarter horses and draft breeds, but it has been found in about every breed.
Yes.
So it's not just I've got a I've got a thoroughbred, I don't have to worry about this. No, this is about every breed.
Yeah, it can definitely be found in all of them. The way that we find it, you can do hair testing, you can do other genetic tests to find it, but also coupled with a muscle biopsy is the way that we would diagnose it. Because what we're looking for is not only the genetic mutation, but also we're looking for extra glycogen or extra sugars in that muscle tissue.
Yeah, let's talk a little bit about what does PSSM cause. Let's dive into, I'm concerned, like when do you need to start thinking about this? When do you need to be concerned? When do we need to start going down this road? Because we're probably not going to genetic test every horse out there.
No.
But let's dive into what signs and symptoms that we're seeing that say, hey, we need to look into this.
Yeah. So a lot of these guys, the kind of hallmark symptom is muscle soreness, or what we call rhabdomyolysis, or what we call tying up. And so this was, they call it kind of the weekend warrior disease. But basically, if you have a horse that's not been in work and you start to work them again, they can get extremely sore. They get really stiff. They can have muscle tremors and fasciculations. They are reluctant to move after you kind of start working them again. And that's basically because there's extra sugars in the muscle that are sitting there, and they're not being utilized appropriately.
Well, if we go back and we talk about what makes muscle relax, it actually takes glucose or energy from muscle to relax. So muscles want to live in a contracted state. And it requires energy to get them to relax. Like, this is not the same condition, but the way I like to explain it is we've all heard the term rigor mortis. And rigor mortis is when the body runs out of blood glucose after you die. And your body gets really stiff and cramps up. That's an extreme form of rhabdomyolysis.
Right.
Because you no longer have the glucose necessary to provide the energy to allow that muscle to relax.
I'm like seeing the little cartoon in my head of the glucose making the ATP, and then the ATP goes and binds to the enzyme, and it unclicks the mechanism, and the muscle relaxes.
Yeah, you get the calcium reuptake, and the muscle relaxes.
Yeah.
I can see the diagram. It's such a beautiful thing.
We're just nerds. It's fine.
It's
anyway.
Okay. I love it.
But yeah, you need energy to relax the muscles, and so if they're not utilizing that energy appropriately, or not utilizing those sugars appropriately to make energy, the muscle can't relax.
Because we basically we've got about 15, when you exercise, the first 15 to 20 minutes of exercise relies on blood glucose. After that, we start mobilizing glycogen from the cells, or glycogen that we've stored in the muscle tissue. This is why your doctor says you need 30 to 45 minutes of exercise a day to lose weight, because you've got to burn through that blood glucose in order to reach into those body stores.
Yeah.
And then when we start reaching into those body stores and we start trying to mobilize that glycogen out of the muscle tissue, everything's great until we get down to one of the branches. And that GYS1 gene, it encodes for an enzyme that helps break down the branch in that glycogen chain, because they're not just long filaments. This is when we get into some nerd stuff. When we talk about alpha-1,6s versus alpha-1,4 bonds.
Oh, yeah.
And how glycogen chains branch. I'm probably the only nerd that...
No, I'm there with you.
So, yeah, the GYS1 gene codes for that when the glycogen actually branches, it's the enzyme that allows us to break that bond where it branches.
Yeah.
And so once amylase takes off down through there and we start mobilizing all that glycogen, we get to where we need that GYS1 gene to code for that enzyme to break down the branch. It's not there.
Right.
It doesn't get access to any more glycogen.
So all that glycogen now is just stuck. Yeah. Can't get broken down. It's just stuck in the muscle, not doing anything. And so then they run out of that energy, that sugar, and so then the muscle can't relax.
Right. And they cramp up.
Yep.
So it can present from a really strong, like we used to see, and I always say if you get to this point, you've been seeing signs for a long time, but these horses really lock up and be unwilling to move.
Yeah.
Like they physically can't move. At that point, we probably, like, hopefully we catch it before we get to that stage.
Yeah.
But sometimes we don't. Sometimes it's the first sign. When we get that, one of the things we do a lot of times when we hear these stories is run a blood test. And we're looking for two things.
Yeah, we're looking for CK, and then AST is our two kind of muscle enzymes. So they get released when the muscle gets damaged or gets injured. And so when you have a lot of muscle cramping, that CK and AST will go up, and that can kind of clue us into, hey, this is a muscle thing that we're dealing with.
Yep. So we'll see that usually about 4 hours after exercise, sometimes immediately. Sometimes they're just slightly elevated. Sometimes they're off the charts. Like I have.
Can't even get them to read.
I've been called out. Some of the first ones I saw were horses that people are like, oh, I got done riding and he just colicked. Like he went, like I've had them lay down.
Yes.
The first two I ever found where they, and this is going back a while, I would get the phone call that, hey, we got done riding and I was headed back to the barn. He just laid down. He just started acting colicky. Well, by the time I get there, everything's fine.
Yeah.
And we run blood work, and lo and behold, here's this elevated CK and AST. And you're like, oh, crap.
Yeah.
He cramped up. He had a little rhabdomyolysis.
Yeah.
We need to get a muscle biopsy.
Yeah. And the thing to remember, too, is if you're dealing with this over long periods of time, or if you have a big episode, well, if you have enough muscle damage and those enzymes and those muscle proteins go to the kidneys, they can cause kidney damage, and you'll get some dark urine, which is
Myoglobinuria.
Myoglobinuria, yeah, because myoglobin is one of those proteins, and if it goes to the kidneys, it's not supposed to be there. It's hard on the kidneys to filter that out, and so you can also get secondary kidney damage from this if it goes on long enough. So
Absolutely.
we definitely want to catch these early, because once the kidneys go, we can't fix that.
No.
So.
And that's why it's important to find these early. Used to we'd have multiple tying up episodes before we ever started looking for this. And now we're catching it when we hear the stories of chronic muscle soreness, chronic back pain, chronic stiffness, unwillingness to work, or they'll start off fine and they get really, really sore, poor performance. Like we try to catch it then.
Yeah.
We try to catch it before we get to the point we've had multiple tying up episodes, because at that point we've got more glycogen that's stuck inside the muscle. We've had more muscle damage, and we've had greater insult to our kidney. So catching it seems to be the foundation. Like I swear every time we're on this podcast talking about something, early diagnostics and early intervention are the key.
Yeah.
But that's especially true when we're talking about the PSSM.
Yeah, and it's an important thing to remember, too, with these guys is it doesn't take a ton of exercise to make them sore.
No.
It can just be just a little bit, your warm-up. Like after your 15, 20, 30-minute warm-up, then they're just kind of, they just get sore, and they don't want to work. They don't want to go forward. It's not always, after you've gone on a really long trail ride or anything like that. It can be light exercise, too.
And sometimes it even leads to behavioral problems. It's like they fight you to go to work, or they don't want to go into the arena. They don't want to go into the pen. They don't want to go to work.
Yeah.
And the way I describe that is, every time they go in there and really exercise, their body cramps up. This is painful.
Yeah.
And I always say, if every time you walk into your kitchen, you get shocked.
Oh, I'd be so skinny.
You're not going into your kitchen.
Right.
Like, you're not going into your living room. Wherever it is that you walk in, you get this electric shock. After a while, you're like, hey, I'm not going in there.
Yeah. Yeah.
So these horses get where they don't want to work, because they figure out, like, hey, I'm going to go do this, and it's going to hurt. And they don't want to do it because it is painful.
They make associations very quickly. Like, they're very smart. And you'll see this in horses with gastric ulcers, too, because they know that that's going to flare it up and be painful. But they make these associations very quickly, and it's really helpful to key into those subtle differences and those subtle changes in behavior and be like, notice patterns. And it's all pattern recognition.
It is.
Yeah.
I love patterns.
But yeah, so, definitely catching it early, going for that muscle biopsy, is going to be one of our best diagnostics. And it's a little more invasive, but it's really not, it's not difficult.
No, it's 2 small incisions. I found out, I was talking with Dr. Valberg, and she said, we've got a newer test that they can get back to work sooner. I was like, well, I usually biopsy them and I go back to work the next day.
Yeah.
And she was like, oh, most people won't do that.
Oh.
And I was like, I didn't know any better. And She's like, yeah, there's no reason they can't go back to work the next day, but people were concerned. But you're talking about 2 small incisions to do this. I mean, we're talking about 1.5 inches maybe.
Yeah.
2 small incisions. We grab a little piece of muscle. We send it up to the lab. The nerds there get it stained up. They read it. They tell us what's wrong, and we move on. It takes about 7 to 10 days for the results to come back. And we have an answer.
Yes.
And like this is the key. Like, so we're going to talk about a lot of different neuromuscular issues. We talked about a few on the last podcast, but knowing which one you have is so critical. They're all managed through different diet and exercise plans.
Yes.
They're all managed. We don't cure any of these. But knowing which one you have is so important because they all have slight differences. But those differences are what allow getting those things correct, or would allow these horses to continue and work. So knowing you have PSSM, and then if we have PSSM, knowing if it's type 1 or type 2, which is where we get into the genetics, is really critical.
Yeah.
And often people say, can we just run the genetic test? Do I really need to do the biopsy? And my response is always, we still need to do the biopsy because guess what? I've had horses with more than one.
Yes. And also, too, I run into a lot because, the diagnostics on this are not inexpensive, but can we just try the diet changes without the test?
Right.
And you can't because the diets are different between the 2 types. Yes. And either diet is not good for a normal horse that doesn't have PSSM.
Correct.
Yeah.
This is not a good diet if you don't have PSSM.
No. And it takes a long time with just the diet changes and the exercise to see change. And so if you've put a horse on a diet that's not something that they need to be on, and you've kept them on it for 3-6 months to try and see am I seeing a positive change, if they don't have PSSM, you've now wrecked them for a good 6 months nutritionally. For what? We don't know.
And that's the thing is, we'll talk about one later on called MFM, myofibrillar myopathy. It looks very similar to PSSM. However, it is managed completely different.
Yes.
Than PSSM.
Yeah.
And then you can have some issues with, like we talked about in one of the podcasts about vitamin E storage myopathies. Even some of those can look similar to PSSM. And so the diet, trying the diet trials, and I've worked on a lot of horses that they didn't want to do the muscle biopsy because that's how we figured this out. It's the muscle biopsy. They don't want to do it. They want to try the diet change, and we end up being 6-8 months down the road.
Yeah.
We're not making progress. Everyone's frustrated, and I said we're frustrated because we're living in a world of confusion.
Yeah. We
don't know what we're actually treating. We're trying to guess our way through.
Yeah.
It'd be like. The way I describe, like, not doing the muscle biopsy is like your car's broken, so you just start changing parts. You're like, it's not running right. Let's change this part, and let's change this part. Let's change this part. Let's change this part. And you've changed a whole bunch of parts. Your car's still broken, and you're just mad, you're frustrated, you're upset because you spent a lot of money.
And a lot of time.
You haven't gained any ground. Where if we just bite the bullet, get the car diagnosed, and change the correct part, then we're great.
Yeah.
And that's the same thing here. You're going to, if you try to just do the diet and management changes, because like I said, type 1 and type 2 are managed completely different. If you just spend the time and the money, get the diagnosis, then we can start to get laser focused on getting this horse back to where they need to be.
Yeah.
And we're not continuing to cause muscle damage.
Correct.
The more muscle damage, the more episodes of rhabdomyolysis, the more times you have muscle damage, the harder it is to get these horses to correct. So early diagnosis, early intervention is really the key for these horses having successful careers.
Yeah, which they can.
You name a discipline, I have an upper level athlete in that discipline with PSSM. Whether it's dressage, jumping, barrels, roping, reining, I've got a horse with this condition.
Yeah.
And they're being very successful.
Yeah. It's just management. Yeah. But yeah, it's they do well though. I was reading and they said if you only manage the diet, about half of the horses improve. If you manage the diet and the exercise appropriately, you take that up to 90%.
Right.
Yeah.
Yeah, PSSM, it's a bump in the road.
Mm-hmm.
It's knowing you've got it, getting very serious about your diet and exercise plans, and this horse is going to do well.
Yeah. Yeah. So let's talk about how do we manage these guys then?
That's a good one.
Yeah. So basically, where do you get your sugars from, right? Sugars come from carbohydrates.
Correct.
So things that are high in starch. That's going to be sweet feeds, corns, wheat, oats, barley, all of those things that we typically feed horses.
Well, and let's talk a little bit about starch.
Mm-hmm.
This gets thrown out a lot, but starch, it's important to understand the hierarchy of sugars.
Mm-hmm.
You have simple sugars, which is glucose is the purest form.
Yeah.
And then you have starch, which are longer chains, but they're very straight chains.
Mm-hmm.
So again, these glucose molecules are just hooked together in a line.
Yeah.
The next step, and that's what they call a non-structural carbohydrate. The next source is what we call pectins.
Mm-hmm.
This is where we have not only the lines, but we have branches in our lines of sugar. And so pectins are not starch. They're not non-structural.
Yeah.
They have structure to them because they have a branch. And then you can get into your next level, and that's when we start talking about cellulose.
Mm-hmm.
And that's when we talk about fiber.
Mm-hmm.
That's a very much more complex form of sugars.
Yeah.
So they're all sugars, but it's how these sugars are linked together.
Mm-hmm.
So the important one we function on is what we call a non-structural carbohydrate
Mm-hmm.
or a starch.
Mm-hmm.
And like you said, that's your cereal grains.
Mm-hmm.
It can also be found in grasses and hays.
Mm-hmm.
Certain grasses and hays have a higher non-structural carbohydrate
Correct.
than others.
Yeah. And this is when we talk about, when we say sugars, when we're talking in grasses and hay and things like that, that's what we're talking about, is that
Right.
non-structural carbohydrate, that readily available energy source that we look at.
Yeah, that water-soluble fraction.
Mm-hmm.
That's
Yep.
why we talk about, this is when we talk about soaking hay. We're removing that water-soluble
We're
carbohydrate.
dissolving the ones that will dissolve in water and taking them away. It's
Correct.
what the whole point of soaking is. It's just all like coming full circle for me right now. This is so nice.
It's kind of fun. I never thought, like I said, I did a lot of nutrition work when I was an undergrad.
It's so important.
I never thought it was going to come back to help me, but
Here you are.
here we is. So,
But yeah, so when you have those sugars, those readily available sugars, think about somebody with diabetes, right? They eat, their glycogen goes up, or their glucose, their blood glucose goes up, their blood sugar goes up. You have to regulate your insulin. This whole thing with muscles and insulin and the glucose, this all comes together. And when your blood sugar goes up, your insulin goes up, this glycogen synthase enzyme goes crazy, and it just makes all this glycogen in the muscle. And if they're constantly making glycogen, they can't break it down, and then you get that glycogen all gets stuck in the muscle, and these guys can't utilize it. And so the more carbs you feed these horses, the worse they're going to get.
right, because the body's storing that because it may need to go get it later.
Mm-hmm.
So when you're resting and eating, you're storing glycogen,
Mm-hmm.
and after you've filled up all your glycogen stores, you go make fat.
Yeah.
And so whatever you don't burn gets stored.
Yep.
Because the body's like, we may need this later. And so, and like I said, we talked about that process of we're going to use the blood glucose first. That's the simplest form. Then we go get that glycogen.
Yep.
Well, same thing when we eat. We're going to fill our blood glucose reserves first. After that's like we got enough blood glucose. Like you said, insulin goes up.
Yep.
And it has to store that glycogen.
Drives it into the cells.
cells.
Yep. Does all the things.
So we have these beautiful glycogen stores for one day when we're out there running from the bear.
Yep.
And we burn through our blood glucose, the body's like, hey, not a problem. I'll go grab this glycogen and we can keep running from the bear.
Except these horses can't do that.
These horses can't do that.
Yeah. Yeah.
So
Get stuck.
they get stuck.
Yeah.
And then the bear gets them.
Yes. The bear gets them, and then it's a bad day for everybody.
So one of the things we focus on these horses is keeping that non-structural carbohydrate part of their diet low, less than 12% of the diet.
Yes.
And when we say that, we're talking about the whole diet.
Yes.
People often want to focus just on grains. It's like, no, this
Hays
is
and
less than
grasses.
12% of the total diet.
Yes.
So these are hays, grasses, and grains.
Everything that your horse is eating has non-structural carbohydrates.
And there's some great resources out there if you're trying to figure out what kind of, like, what kind of hay do I feed? Different hays are known to have higher non-structural carbohydrate forms than others. Ryegrass hay.
Super high.
Stupid high.
Yeah.
In sugar.
Yeah.
Timothy.
Can be very high depending on the maturity of the hay. Yeah.
Right. Most of the time it's actually low.
Yeah.
And a good way to remember this, I always say, here's your windshield nutrition test for, and what I mean by that is like you're just looking out the windshield of a bale of hay and you're trying to decide how much non-structural carbohydrate is in there. The best thing to do is test it.
Yes.
Testing is the best way to do this. You can talk to your county extension agent. Most states have a lab that you can use to actually test hay. You can actually send that to a company called Equine Analytical. They're part of Dairy One. You can send them a hay sample. They can tell you how much non-structural carbohydrates in there. So there's different ways we can test it. But if you're trying to do it out the windshield, you want to look for mature hay.
Yeah.
The more seed heads hay has, the more mature it is, the stiffer it is. That means that glucose that was once stored as a non-structural carbohydrate in that grass or hay is now more lignin bound or is stored as cellulose.
Which is structural. Fiber.
Carbohydrate and fiber.
Yeah.
So that really crappy hay that you're like, I'm not going to feed that. It looks like straw. That's a great hay for these guys. It's kind of weird. It's like, you want you want that relative feed value like 86.
Yeah.
Like you want down there, you want the garbage.
Yeah.
Because because we measure hay quality on the amount of protein and the amount of non-structural carbohydrate and the digestibility. Those are the factors that go into that hay selection.
Yeah.
So the higher the fiber fraction, the higher the more lignin bound, the more mature the hay, the less of this non-structural carbohydrate we have.
Right.
It doesn't take the place of hay testing.
No.
But
because you'll be wrong sometimes.
You will be wrong. But it definitely helps.
Yeah.
So if you can't, because that's the big thing people run into, right, is, it's easy. Like some of the farms I do consulting work for, we go in and we're buying, I've got one, we go in every year and we buy 300 tons.
Yeah.
We buy 300 tons of hay.
Yeah.
We buy it all at once.
Yeah.
And we test that hay. And we buy based on the quality of that hay. Well, again, we're buying a year's worth of hay. If you're buying hay every week,
right,
it gets really difficult because by the time you get the test back,
you've fed it
you
already.
fed the hay.
Yeah.
So if you don't have the ability to store a lot of hay, you've kind of got to use I wish all hay came with the nutrition test.
It would be great if it did, honestly. Like if everybody was required to test their hay before they sold it, it would be...
and I've always said it should come with a hay test, and the price should be based on the hay test.
Yeah. Yeah.
But that's not going to happen, so...
It's just not, unfortunately.
Good rules of thumb, more mature hay, which is by Timothy, because if it doesn't have a seed head, nobody will buy Timothy.
Right, because Timothy, everybody does. If it doesn't have the seed head, it's not Timothy.
Right.
Because it doesn't look like Timothy.
And so when you're buying those seed heads, you're buying a more mature forage that has less digestibility.
Yeah.
So that's usually a good one to start with.
Yeah. Yeah.
Ryegrass.
No.
Just say no.
Just say no. And coastal can go either way.
Coastal is highly variable.
Yeah, it can be low, it can be high, it can be middle of the road, it can be that one is, and you really can't tell.
No, because I've looked at hay and been like, that is trash. And you get the test result, and you're like, wow, that's really good.
That's hot. Yeah.
Same thing with fescue.
Yeah.
Fescue, you cannot tell. It can go either way.
Yeah.
So, one of the first things we start with is trying to reduce, like you said, reduce those cereal grains in our diet. And use a nutritionist.
Yes, please. Yes.
Use a nutritionist.
This is not one to guess, and you need the math on this one because we're not getting those calories and that energy from the carbohydrates like we normally would. We've got to go for fats.
Right.
And that's not how we typically feed horses. And so to make sure your horse is getting the plane of nutrition that it needs and the vitamins and the minerals and everything balanced, like you really need a nutritionist for this one.
No, and there's some great ones out there. Talk to your veterinarian. They can help you find one.
Yeah.
Yeah, I did a lot of nutrition work early on in undergrad and tried to do a master's in nutrition. Just got sidetracked.
You did all the work. You just didn't write the paper.
Yeah, should have, but... I was dumb at 20,
it's
but
okay.
Even so, and I've got that, I don't do it enough And so I still bring in a
Oh, yeah.
nutritionist on some of these cases.
Somebody that does this every day and knows the ins and outs and is familiar with it, and that's all they do. You're just like, if my dog has a problem, I'm going to take it up top to the small animal vets because they look at dogs every day. I don't.
Yeah.
So yeah.
Having that nutritionist, managing that diet, getting those NSCs, total NSCs of less than 12%, and then make sure you balance all the other nutrients.
Yes.
You've still got to provide the right amount of amino acids in the diet, the right amount of vitamins, right amount of minerals. Mm-hmm. We still need an energy source, and we're going to be switching more to fats on that.
Yeah.
Contrary to popular belief, horses are not built to eat fat. Fat will not make you fat. That's always the funniest part. I'm gonna get sidetracked here. People are like, I'm trying to get him to gain weight, so I'm giving him fat. And these are the same people that tell me they're on the keto diet.
And I'm like, so you're eating fats and proteins to lose weight.
And you're feeding fat so your horse can gain weight. Same basic metabolism here.
The math ain't mathin'.
Yeah. But we were taught that. Like, I can remember. It's like, I can't get weight on my horse. Give it some corn oil.
Yeah, give it some corn oil. Give it some rice bran.
But it's carbs.
Yeah.
That make us fat.
Yeah.
But in PSSM, we got to minimize our carbs.
Right.
So we almost have to train these horses
to use
fats.
Yeah.
So.
And to do that, we have to basically keep them at a baseline level of exercise constantly.
That's the second part of this.
Yeah.
You get the diet dialed in.
Yeah.
Now it becomes about exercise.
Yes. Consistency is key.
The diet's the easy part.
Yeah. Yeah.
The exercise
is where it gets people.
Yes.
Yeah. Because life gets in the way.
Right.
Yeah.
And this is where when we talk about exercise, this isn't go out there for 10 minutes. Mm-mm. This is where we're looking at 30 to 45 minute range of exercise.
Every day.
So this is lunging, this is long trotting, this is riding.
Yeah.
Great news, we're going to tell you to ride your horse a lot.
Yeah.
Your vet's going to be like, I need you to ride a lot.
And that's going to be great for the first month, and then when December rolls around and it's rainy and muddy and cold and you're like, oh, I don't want to do this. But you have to. You have to.
You have to ride.
Yes.
This is a solid 5 day a week.
Yes.
30 to 45 minutes of exercise minimum.
Yes.
On these horses.
Yeah.
And that's your minimum.
Yeah.
If they can go every day, even better.
Yeah.
Because what we're trying to do is minimize the exercise. Helps us continue to break down, use up blood glucose, and also helps us mobilize that glycogen out of the cells. Because if we get too much of this glycogen built up in those cells, they no longer function like they should.
Right.
So it's not just not being able to get the glycogen into glucose to get them to relax, but also these huge glycogen stores will start to cause issue with the muscle as well. Like you'll actually, the worst one I ever saw, I had a biopsy come back and it had stored so much glycogen that the muscle cells were actually apoptosing or dying and being replaced with fat cells.
Yeah.
This horse was literally because it was pushing 20 years old before it was ever diagnosed.
Yeah.
It had all these problems that came in. And I was like, holy crap, has somebody seen this?
Yeah.
And it was the worst biopsy report I ever read because we're now end stage. There's nothing I can do to slow this down, nothing I can do to reverse it. Like we went too far.
Yeah. Yeah, and that's, these horses sometimes they'll look really muscular, but their muscle is squishy.
It's just poor.
Yeah. Or they won't have a lot of muscling. I mean,
this horse had no muscle.
Yeah.
Came in for a lameness exam, and I was like, no, your problem is not being lame. It's like you have no muscle.
You can't move, you don't have the strength to move your skeleton appropriately.
Yeah.
Yeah.
And I can remember, I can still see the picture of the slide in my head. Like it was
awful.
Wow.
Because we send the muscle in and they stain it with these special stains that basically highlight the glycogen in them, and so a normal will come back and it's this pretty light purple color and it's beautiful, and then a PSSM comes back and it's dark purple, and then it also has these big splotches of really dark purple that are a different type of sugar that's stuck in there too.
If you're watching on YouTube, we're going to throw some pictures of that up there.
They're really pretty. They
really are.
Pretty. Yeah.
They really are.
Yeah.
And the worst part is some of the ones with all the glycogen in there are even prettier.
Yeah.
Which is bad.
Yeah.
I'll see if I can find the one that had the...
that would be good.
Yeah, I think I remember which horse. I know exactly which horse that is. So
Yeah.
I'll try to get that one put up as well.
That'd be good.
So you can kind of see what end stage on this looks like.
Yeah.
But it's bad when we get to that point.
Yes. So we don't want to get to that point. We want
No.
to catch this again. Early diagnostics.
Yes.
Yeah.
So managing that diet and an exercise routine, and it's going to be slight variations between type 1 versus type 2.
Yes.
And that's your biggest difference in the two. They still end up with the same result.
Yes.
One's genetic. We'll segue into a type 2.
Mm-hmm.
Type 2 occurs, and we have no idea why.
Yeah. We're still figuring it out.
Yeah, we don't know why this happens. We just know they end up with a ton of glycogen stored in their muscle tissue, and we're not sure why.
Mm-hmm. And type 2 is going to be more common in your warm bloods, for sure. So it's we're figuring it out.
Yeah, we're getting there.
The smart people are doing the smart people things.
And I remember listening to Dr. Valberg talk at AEP one year doing the Milne lecture, and she said that she felt like type 2 PSSM was a catch-all for a lot of different muscle issues.
Yeah.
And we've had several different neuromuscular diseases that we've identified that were originally grouped into a type 2 PSSM.
Yes. Yes.
So we're learning more every day. We're starting to understand this more and more. We're really, there's been a lot of work. I mean, I look, when I graduated vet school, I remember one slide like, oh, here's PSSM, it's this muscle thing.
Even when I did, I mean, it was a couple slides on 1 and 2, and it was like, yeah, it's just a glycogen storage disorder, and you just muscle biopsy and genetic test, and off you go. And I was like, okay. And then I get out and, working with you, I'm like, oh.
There's a bunch.
Yeah.
It's way more common. Like they
Yes.
kind of breeze through it, but this is real. This is more common. I always say things are uncommon for two reasons.
Yeah.
Either A, they're uncommon, or B, they're uncommon because we don't look.
Yes.
And you'd be amazed how many of these you find when you start looking.
Yeah, because we do a doctor's meeting every Monday, and we've kind of been just picking each other's brains. And my question last week to Dan was, how do you decide to do a muscle biopsy? Like, what's your train of thought or your thought process? And it's all pattern recognition and those little things. But then I was thinking back to horses that I've seen, and I'm like, oh man, yeah, I could have tested that one. I could test that one. I could test that. Like we don't look enough.
Once you start to understand that pattern, you see that pattern enough.
Yeah.
Because I can remember it would take me forever to get one of these diagnosed.
Yeah.
And now I'm catching some of them on the first visit in. Like I'm looking at them, I'm going through things. They're telling me the story because the stories, like this is why history is so important.
Yes.
History is so important, and you start asking questions. And that's why some people, they always, I love it or I hate it when people come in, they're like, well, I don't really want to tell you anything because I don't want to, sway your opinion. I want to see what you come up with.
They say that?
Yes.
Why?
When I'm like the second or third opinion, they'll tell me that, and I was like, look, you can give me the history, or we can play Stump the Veterinarian. I want to help you. Let's don't play Stump the Veterinarian.
Also, you're not the one.
No. You're not going to sway my opinion.
No.
Like, I need you to tell, because it never fails. It's like you start having conversation, you can tell somebody's holding back, and I look at them like, now's not the time to hold back.
Oh, yeah.
Like, you need to let it flow.
Hash it out.
They start telling me all this stuff, and I'm over there scribbling down notes, and then it's like certain phrases, they hit on these things, and they hit on these certain things that come up in the history, and it's funny because they'll say the same sort of things over and over. They talk about this poor performance, not wanting to work. They get really stiff 15 to 20 minutes into exercise. If they give them time off, they're worse.
That's what we were talking about with the consistent exercise. If you put these horses on stall rest, bad.
Some of the first ones I found would, I'll never forget, I had one that he had an injury, and we stall rested him for a couple weeks because of this injury.
Yeah.
And then we went back to work, and he came out 2 rides back, and I mean, I'm getting the phone call. They can't get him out of the arena. He's just tied up, will not move.
Oh, buddy.
And I was like, all right, let's get this treated, and we'll get a muscle biopsy. Sure enough, we came back.
Yeah.
PSSM.
Yeah.
And let's talk a little bit about that. When you have one of these episodes and they really tie up, and that CK and AST is really high, this is not the time to be conservative.
No.
We need to get fluids into these horses ASAP.
We've got to flush all that muscle, the myoglobin out. We've got to flush those kidneys out to salvage the kidneys and just basically just help them flush everything through and process everything. And we've got to get them moving again.
Because if you have enough episodes of rhabdomyolysis, you will end up in kidney failure.
Yes.
And I have found one that was in kidney failure. Mm-hmm. And that's what led us to, it was kind of a weird deal. Like, he came in and he was having an issue with his kidneys, but then I also saw the CK and AST that was elevated, dug into the history, because it started out he didn't want to eat.
Yeah.
Didn't want to eat. I ran blood work. BUN and creatinine was up.
Yeah.
So was CK and AST. So I dug into the history. Digging into the history, I was like, holy crap, like.
He's been tying up.
He's been tying up for a while.
Yeah.
So we ran genetic testing, ran a biopsy. He had type 1 PSSM, HYPP.
Oh.
I had both.
Dang.
So he was a dual offender. This was leading to the kidney disease.
Yes, and it will. It absolutely will. And like I said, once those kidneys go, we can't fix that.
No, kidneys don't regenerate.
They do not.
So it's really important if you have one of these episodes, this time to get a hold of your vet. Mm-hmm. We need to get aggressive because, like I said, it will lead to kidney failure. And if we end up in kidney failure, we don't have a lot of treatment options for that.
Nope.
So.
Nope, we do not.
Early intervention.
Always.
And what's exciting, like one of the things too is, used to if I didn't have that increase in CK and AST, I wasn't as prone to biopsy. But I can tell you, I'm identifying them earlier. I'm not seeing those big increases in CK and AST, and I'm still biopsying these horses. Mm-hmm. And we're finding it sooner than I used to. And I almost feel like if you get to the point where they're having these major tying up episodes with these huge increases in CK and AST, I feel like we've missed it.
You're already a little too late.
Yeah, we missed it.
Yeah.
So we need to find it before we get there.
Yeah.
Identify these other symptoms earlier on so we can, because early intervention is the key to this. Because once that glycogen's in there, we cannot get it back out. Mm-mm. So early intervention is really the key on these horses having successful careers.
Yeah. So if you have a horse that's getting stiff into exercise, is having some muscle tremors, doesn't want to work, is, just not performing the way they should, think about this.
Yeah.
Talk to your vet. See if it might be a possibility. The muscle biopsy is easy to do. Any of us can do it. I've done several.
Yeah, it's not a difficult procedure.
It's not. The lab where Dr. Valberg works is fantastic. You just send it off to them. They'll get you an answer, and they give you. I've been looking at these write-ups on some cases that we've had. They send you back the biopsy slides, and they give you a whole report on. They tell you exactly how to manage it. They give you all the resources. Like, it's fantastic. And like Dan said, it's a bump in the road. If we catch it early, we can manage it. We can get these guys back to work. We can get them to be successful. And, we just need to know what it is that we're dealing with.
Well, it's important, too, when we talk about the management, like I was looking at your sheets.
Yeah.
And that's usually what I do. I send them, like, hey, we're going to talk about this, but I'm going to send you this write-up. Mm-hmm. And it's got all the stuff in there. I want you to read this.
Yes.
After you read it, we're going to sit down and talk.
Yeah.
Because you need to read, process, and we're going to sit down and talk, and we're going to lay out a plan.
Mm-hmm.
And by laying out that plan, I always say, like, the initial plan we lay out is going to get us, like, 80 to 90% of where we need to be. Mm-hmm. And then we're going to make subtle tweaks to get us the rest of the way.
Yeah.
But starting here is going to get us 80 to 90%. We're going to look at it. If we're struggling, I'm going to bring in a nutritionist. Mm-hmm. I'm saying, all right, we're going to bring in this nutritionist. They're going to help us manage this.
Yeah.
And by that, I don't mean just the guy at the feed store. I mean someone who's got advanced training, master's degrees, and PhDs
yes.
in nutrition, and
yes.
this is what they do.
Yes.
So we're going to get that. We're going to get those diets formulated. And we talked about this a little bit last week. Another critical part of this diet is vitamin E. These horses with PSSM have more oxidative stress. They have more of these reactive oxygen species, this oxidative stress going on in their muscle. They need much higher doses of vitamin E than a normal horse.
To combat that oxidative damage, yeah.
I mean, most of these horses sitting around 5,000 to 10,000 IUs of vitamin E. And so we got that added in.
Yep.
We get these diets managed.
Yep.
Time of the year is going to matter because it's going to be different in wintertime than in summertime. So I always say if we can get through the first year and you pick up on all the patterns, if we can make it through that first year of PSSM, you're going to have the knowledge you need. And that's the most stressful year.
Yeah.
And I always tell people, just get through the first year. Don't give up.
Yeah.
Let's get through the first year. And managing this becomes almost automatic.
Mm-hmm.
Like it becomes just a new way of thinking.
Mm-hmm.
So you pay attention. All right, we got fresh green grass coming up in the spring. You know what? We need to make some changes to account for those sugars that are going to be in the diet.
Yeah.
So
Yeah.
really cool.
Yeah. It's good stuff.
Really fun condition.
Yeah.
So what are your key takeaways? If people got 3 things out of this, what would those 3 things be?
Yeah, I would say my key takeaways would be definitely early diagnosis, and then diet and exercise. And consistency. Yeah.
I agree 100%.
Yeah.
Early diagnosis, accurate.
Yes.
Early and accurate.
Yes.
Not guessing,
No.
not hoping. Hope is not a plan.
Hope is not a plan.
Hope is not a plan. Don't throw crap at the wall. See
we
what
need to
sticks.
put that on a T-shirt for some merch.
Hope is not a plan.
Hope is not a plan.
That's it. Early diagnostics make the difference.
Oh, yes.
Early and accurate.
Yes.
Know what you're dealing with. Don't guess. This is not the time for empirical treatment.
This is not try and see. This is not, no.
This is get the answer.
Yeah.
Get the answer. Hone in on the diet and exercise program. Consistency is everything.
Yes. Yes.
And the great news is, we're going to talk about some other conditions that aren't this way, but the great news is this one, very manageable.
Yeah. As long as we know we have it, as long as we know what we're dealing with, we can manage our way through it.
It's rare that we can.
Yeah.
So, really cool topic. I love neuromuscular. Huge fan. Love it. It's a lot of fun.
It is. It is.
It's pretty cool.
It's fun to watch all of the pieces in the puzzle come together to make it all make sense.
Yeah, that's the thing. When I first started doing sports med, I really thought I was just going to be looking at things limp all the time.
Nope.
No, it affects every aspect of performance. So you've got to understand muscle physiology, understand all the orthopedic work, even stomach ulcers, airways.
Yeah.
It's kind of a combination of like
Heart murmurs sometimes will come in there, you know.
it's like a little bit of ortho, a little bit of internal med,
Yeah.
it's kind of a little bit of neuro. It's
Yeah.
kind of all rolled into one. It's this catch-all of all the different specialties, but how do they affect the performance athlete?
Right.
That's why I love doing sports med. It's fun.
I like the internal med side. I'll stay over there, but
Yeah,
it's
I'm
okay.
a sports med junkie. So.
What did you say to me the other day? Yours all cry and mine all die.
Yeah, I think that's what it is. Like,
Not always, but
not always, but internal med is where things go south.
yeah, but it's okay.
In my world, everybody just cries.
But then you fix them and it's great.
We fix them and they have a great day.
Sometimes I fix mine.
My favorite days are, you get some of these runs where you're constantly diagnosing things, giving people bad news, they're getting really upset.
Yeah.
But then you get that magical day where you're doing a bunch of rechecks and these horses are back and they're 100%. And you just watch people leave out just smiling, happy, excited. It's so much fun.
Yeah, that's a good day.
I would say my favorite thing is a lame horse.
Yeah.
My second favorite thing is when they're sound. So it's pretty cool.
Oh, man.
Well, thank y'all for tuning in today. It was a pretty good show.
Yeah, it was
I
fun.
I enjoyed it.
Yeah.
I did a little dive in neuromuscular.
Hopefully
I
we
like it.
didn't make it too confusing.
Now, if you got questions on it, though, feel free to send us some questions. If we didn't cover something,
Yeah.
let us know. Because there's definitely going to be some follow-up episodes to this.
Yeah.
So, yeah.
Sometimes we get excited and we get ahead of ourselves and we know what we're saying, but it's okay. I
Yeah.
think we did good.
I have a lot of fun.
Yeah.
So, yeah, if you got a question, reach out to us. If you think your horse may be dealing with this condition, reach out to your vet.
Please.
Go ahead and get this, talk to your vet. Let's get an answer for it. So,
Yep.
appreciate everybody tuning in. Thanks to our listeners out there for making this podcast successful. April, thanks for recording everything. Casey, thanks for editing. And from all of us here at Countryside Equine Hospital, y'all have a great week. Take care.